Do you abuse your feet? Because podiatrist Dr. Rob Donaldson has some really integral advice to help us. He's going to be on the line to help us understand, get ourselves on the right foot, and really rid us of some of those really uncomfortable foot issues. That's coming up after the 4:30 news.
Live Unrehearsed on CJAD 800. Brought to you by Marco Vendramini of IG Private Wealth Management. MarcoVendramini.com.
And welcome back to Life Unrehearsed as Corrie's popping away at the other end. Corrie, I think that's your mom's favorite song, isn't it?
It is.
I'm Matt Del Vecchio, specializing in life transitions, downsizing in the senior living industry.
And I'm Corrie Sirota, clinical social worker and psychotherapist, specializing in grief and loss. So, Matt, yet again this week, I had the pleasure and privilege of watching you on global television. Also, there was a national podcast, iHeartRadio network you were on. It is always a pleasure to hear what you have to say, but it's also really, really important information you're sharing.
Yeah, no, thank you very much, Corrie. It's I'm fortunate different media outlets are reaching out because there is so much uncertainty about the state of long-term care and residences and so on. So, in fact, what we did, we had a few calls and we said, you know what, just post the interview on the Life Unrehearsed Facebook page. So it was just posted on, and it's really discussing long-term care and what needs to be done to improve the health and well-being of our seniors, Corrie. So you can go on the Life Unrehearsed Facebook page to catch some of that interview and some of that information.
Thank you.
Thank
because
you.
it's so really you've got to listen to it. You make it so easy to understand. So I appreciate that, and here's an opportunity for people to hear just how important this information is. So that being said, moving right along today online right now, foot pain. Did you know that how it can have a profound impact on your quality of life? Half of the adults say that foot pain has restricted their activities like walking, exercising, working, or depending on your age, playing with your grandchildren in some way, shape, or form. But only a small percentage actually go to a podiatrist to get their foot and ankle issues resolved. Well, perhaps after hearing from our next guest, attitudes might change. We're very, very pleased to have the esteemed podiatrist, Dr. Rob Donaldson, on the line. Welcome to Life Unrehearsed, Dr. Donaldson.
Hi, guys. Thanks for having me on today.
I
was really impressed with the music you chose there, Footloose.
Well, we have the best time choosing the music. It's
Very
always
original.
themed. Thank you for noticing it. So,
I wonder if anybody else did. I certainly did.
well, my mom, because she loves the song. So, what are some of the most predominant foot and ankle care issues that you see on a daily basis?
Well, we're like family doctors, so to speak, in regards to foot issues, or a family dentist. We see a wide variety of stuff. Some of it we treat ourselves. Some things and pathologies we can diagnose, but we refer to specialists. So we're like the gatekeeper, so to speak. So we see all types of dermatological issues. It could be skin issues like corns and calluses and plantar warts and athlete's foot, blisters and ulcers. And you can also encompass nail issues under dermatology, which is fungus of the toenails and nail trauma and hematomas and bruises under the nails. Also deal in neurological and vascular problems. So we're there, like I said earlier, to diagnose them, but we don't necessarily treat neurological and vascular issues, but we'll refer them on to neurologists and vascular surgeons if needed. The other bulk of our stuff is musculoskeletal or inflammatory problems. Tendinitis, plantar fasciitis, bursitis, different types of arthritides. So a lot of rheumatoid arthritis, gout, osteoarthritis, psoriatic arthritis, and also a lot of injuries. So a lot of what we do is sports medicine related. And then there's the mechanical issues, things that we get from overuse in runners or in walkers that are active or stand all day. So and they generate many times from birth. So it's flat feet or high arched feet. And then there's the problems that you acquire with time that are also mechanical, like bunions and hammer toes and other there's a whole host of other types of bone problems that we see. So that's pretty much it in a bulk. So it's derm, neurovascular, and musculoskeletal issues.
Corrie, your feet sore now after listening to that?
Yeah.
We're listening to Dr. Rob Donaldson, podiatrist, and no wonder half of all people have some form of foot issue after hearing from you, Dr. Donaldson. And I didn't realize, but in doing a little research, in fact, diabetes and foot care is actually quite important. So do you see that? And I guess I would also want to address with the pandemic and not being able to see people, it could actually be quite serious, can't it?
Yeah, absolutely. During the pandemic, we were an essential service. And one of the reasons is because we have quite a few diabetics as patients. Mm-hmm. And we were only required to see emergencies, diabetics, breaks, all fractures, infections, things of that nature. So I'd say I didn't work a lot until June 1st, and I'd say the majority of my patients were diabetics. Certainly don't want these people that are already sometimes in poor health to be going to the emergency rooms. So we saw quite a few of them.
And what is the connection,
though? The diabetic issues that we see in diabetics pertain to bad circulation and neurological issues. Long-standing diabetics that are poorly controlled have poor circulation, especially in the elderly. And they also have what's called neuropathy. Neuropathy is a lack of sensation in the extremities, the feet in particular, because of long-standing high blood sugar levels. So what you and I may feel on a regular basis, a diabetic may not. So they're very prone to infections because they don't realize and they don't feel it. So what would hurt us, they may not. So there are a lot of ulcers that are developed from that. And this is the reason why diabetics often and should always, that have poor neurological deficits, should always be wearing shoes around, all right? Because they're unable to sense standing on a rock or a pebble or a tack or anything sharp. And if they're often living solo or don't have the privilege of having somebody inspect their feet, then they also have poor eyesight that comes along with that. So they can't detect problems. They can't feel the problem. They can't see the problem. And in bad ulcers that often smell, they can't even sometimes smell the problem. So yeah, there was quite a few diabetics, especially during the pandemic.
That's quite a list of potential issues just alone for someone who's a diabetic. That is podiatrist Dr. Rob Donaldson sharing some very important with us. So you mentioned something. I don't even like to say the word. I get this, so I know when I see even a commercial for Toenail. I'm going to say it, fungus, and it's embarrassing. It's uncomfortable. But we need to talk about it. You said you treat it. How do we do it? Actually, we just got a text about it. What's the treatment for toenail fungus?
Yeah, well, nail issues are a good bulk of what we do dermatologically wise. The first step in evaluating nail issues is definitive diagnosis. So everybody that comes in with a nail that may look a little different or thick or yellow have all been told that it's fungal. And sometimes nail issues can be caused by trauma or repetitive trauma or a loss of nail or ill-fitting shoes. So to diagnose fungus, you need to actually culture the nail. You need to remove part of the nail that's diseased or questionable and send it to a lab and have them test it out and make sure that it's fungal. If, in fact, it is fungal in nature, there's different ways of treating it, and it depends on the severity of the problem. For mild cases, creams and lotions can sometimes work. For more moderate cases to medium-sized cases, there exist lacquers, all right, over-the-counter and prescription lacquers. These are nail polishes, so to speak, that we apply to the nail, and they're transparent. So no one can see that something has been applied to these nails. In severe cases where 80% of the nail or more is affected, then you got to go to something oral. And that commercial that we see on TV that we're Actually, you'd think that a podiatrist would be the one that's marketed that commercial, but it's the name of the pharmaceutical company that makes this. It's a pill. It's an oral pill that you take once a day for 3 to 4 months.
Dr. Donaldson, sorry, we got to cut you off here because we're running a little behind. We have to head to the CJD Traffic Center with Mark Shaloub, and we're going to hear back on proper foot care, what Dr. Donaldson's going to recommend to all of us, even if you don't have foot care issues.
Live Fun Rehearsed on CJAD 800. Brought to you by Marco Vendramini of IG Private Wealth Management. MarcoVendramini.com.
Welcome back. You're listening to Life Unrehearsed. I'm Corrie Sirota, along with my co-host Matt Del Vecchio, and we are talking with podiatrist Dr. Rob Donaldson. I think that some people might say, I don't have any foot issues. I don't need to really know much about this. But I think that I'm equally interested in those people that don't have the issues. Okay, so how do we make sure that we keep it that way?
Well, I guess like anything in medicine, probably prevention, right? People being aware of the problems that exist in the feet, people dealing with problems immediately and not being, I guess, just not putting it on the side burner, taking initiative and not procrastinating. I think shoe gear is a big part of this too. See people of all ages and genders trying to fit into shoes that are just not possible. Not being guided in the right direction in terms of running shoes. And it could be skates or ski boots or any other activity that requires any proper shoe gear. I think people now, because it's so much, the way people dress at work is so much casual now, I don't see nearly the amount of problems in regards to women in high-heeled shoes. And now with everything going in a different direction and people working from home, it's probably not good for business for me either. But it's all about being aware, okay? I see a lot of people that go away on vacation in new shoes and not broken in, or somebody that goes hiking for a weekend. And so a lot of people that are novice in terms of the activity that they're doing, or somebody that's trying to get involved in a new sport for the first time.
It makes perfect sense, and simple solutions that we need just to be aware of it. We're talking to podiatrist Dr. Rob Donaldson, and if you could see our text board here, there are a lot of people that have bunion issues, Dr. Donaldson. Man, oh man, lots of texts and lots of questions about bunions, and I know technology has improved, and so how are you treating it these days?
Well, not all podiatrists perform surgery. All podiatrists perform minor surgeries like warts or ingrowing toenails or soft tissue lesions, cysts, and masses. But not all of us do osseous or bone surgery. A small percentage of us are U.S. trained, myself included. So the techniques over the years, I can't say have really changed much, but the avenues in which they're performed have. Being hospital trained back in my day, 28 years ago, everything was hospital based. And now, to save money and to cut costs in the U.S., a lot of the surgeries are done in these surgery centers, so it's day surgery. And in fact, myself and the majority of the podiatrists that do bone surgery now, it's all done in office. Under sterile operating room environment, but all under local anesthesia. And that's very helpful for a lot of reasons. One is you're not in a hospital with a lot of sick individuals. It's a quick process. It's an in and out, so to speak. And stats will show that there's actually less post-op infections when surgeries are performed in an operating room, in an office setting, or in a clinic, a day surgery type clinic. But in terms of what's changed, I'd say the hardware that we use when bones are cut, they're called osteotomies, and they're realigned. The screws are different now than when I was a resident. The pins, everything that's used to hold bones together. And that's a huge advantage for the patient, because oftentimes patients don't need to be immobilized in a cast. So everything's been geared to quicker return to recovery, because people can't afford to take a month or 2 or 3 off their jobs, especially if they have jobs where they're standing all day.
Right.
So, yeah, techniques are the same, but it's all about quick and lessened rehab.
Okay, speaking of quick, thank you. So you do surgery. It's very important to know, and it makes it a lot less invasive when you're not going to hospital. So thank you for sharing that. Very quickly, a texter asked about their 14-year-old son who walks on his toes all the time, and she's asked him to stop, and he complains of a sore foot. Can it cause other issues?
The 2 most common causes of toe walkers are either a congenital problem where the Achilles tendon is tight, or an injury that's caused that tendon to tighten, or it can be habitual. So it's habit forming.
Right.
And in 14-year-old children, I don't see it too often, because they usually break the habit by then because of peer pressure from their peers. But I see it a lot between the ages of 4 and 8, so to speak, I'd say. So that needs to be examined. If it's due to an Achilles tendon that's tight, it needs to be stretched. So that's a lot of physiotherapy and rehab could be necessary. And in the most severe cases, sometimes a tendon lengthening needs to be done on the Achilles tendon. But that's an easy thing to diagnose. And if it's habitual, nothing much we can do about it other than parents getting on their kids.
Well, great advice. That's podiatrist Dr. Rob Donaldson. Dr. Donaldson, how can people get a hold of you?
I've got 2 clinics, one in the West Island on Sources and Dollard. That number is 514-421-6777, 421-6777. And I'm in the East End. I got both ends of the island covered. And that one's 514-722-1011, 722-1011. And if I'm not at one, I'm at the other.
Great. Thank you very much.
Thanks for having me, guys.
All right.
It.
Wonderful. Corrie, what do we have next week?
I'm so excited. Next week on Life Unrehearsed is Father's Day, and we are thrilled to have internet sensation DJ Pryor. More than 40 million people have seen his hilarious video where he has an adorable conversation with his 2-year-old son. He is an amazing father and a great role model. You do not want to miss that interview.
Can't wait for that one. And we're also going to be talking to Joe Morena, the legendary owner of the iconic St. Viateur Bagel, and he'll be with us along with his son Vince, and we'll hear their family secrets to success. That's next Sunday at 4 p.m., where you can catch us every week on CJD 800.